Good day everyone, I am Ayan Franzen A. De La Serna from 12F and Group 22. So for today, I'll be going to perform my return demonstration about the intramuscular administration. So prior to conduct the procedure, the first thing that we need to do is we need to check the doctor's order. We need to check the medication administration record and check the label on the medication carefully against the EMAR to make sure that the right medication is being processed. Okay, so follows the 3 checks for administering medication. Read the label on the medication when it is taken from the medication cart, before withdrawing the medication and after withdrawing the medication, and also organize the equipment. Then perform hand hygiene and observe other appropriate infection prevention procedures to prevent the spread of the microorganisms. So now let's proceed to the preparing the medication from the ampules. First is we need to perform hand hygiene and observe appropriate infection prevention procedure to deter the spread of the microorganism. Prepares the medication ampule for drug withdrawal. Flicks the upper stem of the ampule several times with a finger. This will bring all the medication down to the main portion of the ampule. Then use an ampule opener or place a piece of sterile gauze or alcohol wipe between your thumb or between our thumb and or around the ampule neck, and break off the top by bending it toward you to ensure that the ampule is broken away from myself and away from others. The sterile gauze protects the finger from the broken glass, and any glass fragments will spray away from the nurse. Places the antiseptic wipe packet over the top of the ampule before breaking off the top. This method ensures that all glass fragments fall into the packet and reduces the risk of cut. Disposes of the top of the ampule in the sharps container. Then, next is withdraws the medication. Attach the filter needle straw to the syringe. The filter needle or straw prevents glass particles from being withdrawn with the medication. Then removes the cap from the filter needle and insert the needle into the center of the ampule. Then do not touch the rim of the ampule with the needle tip of shaft, because this will keep the needle sterile. Then withdraw the amount of drug for the dosage. Then with a single dose ampule, holds the ampule slightly on its side if necessary to obtain more than the ordered amount of medication. Then disposes of filter needle by placing in a sharp container. Then if giving an injection, replace the filter needle with a regular needle. Tighten the cap at the hub of the needle and push solution into the needle to prescribed amount. Let's proceed to administering the intramuscular injection. So first is we need to check the medication administration record and check the label on the medication carefully against the EMAR to make sure that the right medication is being processed. Okay, so next is check, follows the 3 checks for administering medication. Read the label on the medication when it is taken from the medication cart, before withdrawing the medication and after withdrawing the medication. And also organize the equipment. Then, perform hand hygiene and observe other appropriate infection prevention procedures to prevent the spread of the microorganism. Then, prepare the medication from the ampule or vial for drug withdrawal. Then, provides for the client privacy. Good morning, sir. I am Ayen, your student nurse for today. Okay, so may I know your name, sir?
Thanks.
Okay, so when is your birthday?
July 17.
Okay, so today I'll be going to do the intramuscular administration. So I'll be going to inject some medications to you. Then I have already closed the door so that no one from the outside can see us. Assist the client to a supine lateral prone or sitting position depending on the chosen side. If the target muscle is the gluteus medius, then have the client in the supine position flex the knees. In the lateral position, flex the upper leg, and in the prone position, toe in. So, appropriate positioning promote relaxation of the target muscle. Obtain assistance in holding an uncooperative client to prevent injury due to sudden movement after needle insertion. Then explain the purpose of the medication and how it will help using language that the client can understand. Include relevant information about effects of the medication. Select a site free of skin lesions, tenderness, swelling, hardness, or localized inflammation, and one that has not been used frequently. If injections are to be frequent, alternate sites. Avoid using the same site twice in a row. Then locate the exact site for the injection and apply clean gloves. Then clean the site with an antiseptic swab using a circular motion. Then start at the center and move outward about 5 cm or 12 inch. Transverse and holds the swab between the third and the fourth fingers of your non-dominant hand, and in readiness for needle withdrawal, or position the swab on the client's skin above the intended site. Then prepare the syringe for injection. Then remove the needle cover and this card without contaminating the needle. If using a prefilled unit dose medication, take caution to avoid dripping medication on the needle prior to injection. If this occur, wipe the medication of the needle with sterile gauze. Injects the medication using the Z-track technique. Uses the ulnar side of the non-dominant hand to pull the approximately 2.5 centimeter or 1 inch to the side under some circumstances, such as for an emaciated client or an infant. The muscle may be pinched, pulling the skin and subcutaneous tissue, or pinching the muscle makes it firmer and facilitates needle insertion. Holding the syringe between the thumb and the forefinger as if holding a pen, pierce the skin quickly and smoothly at a 90-degree angle. Using quick motion lessens the client discomfort. Then, holds the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back on the plunger with your dominant hand. Aspirate for 5 to 10 seconds. If the needle is in small blood vessels, it takes time to the blood to appear. If blood appears in the syringe, withdraw the needle or discard the syringe and prepare a new injection. These steps determine whether the needle has been inserted into a blood vessels. If blood does not appear, inject the medication steadily and slowly, approximately 10 ml or 10 seconds per ml, while holding the syringe steady. If using the ventrogluteal site, injecting medication slowly promotes comfort and allows time for tissue to expand and begin absorption of the medication. Then after injection, wait 10 seconds if using ventrogluteal site. Waiting permits the medication to disperse into the muscle tissue, thus decreasing the client's discomfort. Withdraws the needle smoothly at the same angle of insertion, minimize tissue injury. Applies gentle pressure at the site with a dry sponge. Use of an alcohol swab may cause pain or burning sensation. Then it is not necessary to massage the area at the site or of injection. Then massaging the site may cause the leakage of the medication from the site and result of or in irritation. Okay, so if bleeding occurs, apply pressure with a dry sterile gauze until it stops. Then activates the needle safety device or discard the uncapped needle and attach syringe into the proper receptacle. Okay, so sir, do not massage that area, okay? Then, removes and discard gloves and perform hand hygiene. Documents all the relevant information, the time of administration, drug name, dose, route, and the client's reaction. Then assess the effectiveness of the medication at the time it is expected to act. And that's all for my return demonstration about the intramuscular administration.